You've heard phrases like take a breath, breathe easy, or breathe new life into it. Our language is filled with phrases that tie the act of breath to peace, health, and a fresh start. But for many, that easy breath is a daily struggle. Lung health. It's fundamental to your body, and today we're joined by an expert from Trinity Health to learn how to keep them healthy and how they're using the latest medicine and technology to help affected patients breathe a sigh of relief. Fellowship-trained thoracic surgeon Dr. Behrooz Shabahang is here to discuss lung health and how Trinity Health is using that tech to improve outcomes for patients. Good morning. Welcome.
Good morning. Thank you for having me.
Can we start with how someone might know that they have a problem with their lungs? How would one know that it's serious?
Absolutely. Some of the early symptoms of lung cancer are cough, shortness of breath, chest pain, fatigue, weight loss. These are some of the early signs, but hoarseness would be one of the later signs.
Hoarseness, and this is, of course, not just a one-off, two-off. This is consistent.
Persistent.
Persistent cough, persistent hoarse throat, those early signs might mean a trip to the doctor. But let's say before we get to the doctor, how do we just keep our lungs healthy? What do doctors say the best way to keep them healthy so we don't have to go to the doctor?
Well, I mean, one of the obvious things is stop smoking and vaping, stay away from pollutants, and stay away from areas of high radiation, and exercise. Lots of good exercise where your lungs are
and we've been told that for years. Got to listen. Exercise, quit smoking if you can, right? The two main things there. But the technology you guys are using, the robotics, Ion, tell us about that.
Well, Ion is made by Intuitive Surgical, and it's a robotic navigational bronchoscopic system that allows us to reach the very difficult areas in the lung. And our resolution limits are down to 6 millimeters, so we can really tackle these early lung cancers and make a difference.
And let's talk about the screening. Who should be getting screened right now for this?
The lung screening criteria is folks between 50 and 80 years of age who have 20 to 35-year smoking history. These people qualify for screening, and most insurance carriers and Medicare and Medicaid will allow it.
You definitely want to look into that screening, especially if you met the criteria there on your screen. And you're part of a cancer network. You can find these anywhere. Where are these places?
The cancer network consists of Trinity Health Grand Rapids, Trinity Health Muskegon, University of Michigan Health West, and then of course Michigan Medicine in Ann Arbor.
So basically wherever you are in this state, you're not far from this cutting edge care.
Absolutely.
Absolutely. We want you to look into that as well. You may qualify for that lung cancer screening. If you meet those criteria on the screen, just go to trinityhealthmi.org/lung.